last slide is that it is a treatable illness. Again, you need to emphasize it's a chronic brain disorder, and people can recover, and they do recover from substance use disorder. I treat a lot of patients here. They do recover and they have wonderful lives afterwards. So it is a treatable illness. The message that you can give people is it's a chronic brain disorder. Please seek treatment for it. And these are some of the references, and then we can take questions. Thank you.
Thank you so much, Dr. Numan, for the wonderful presentation and explaining to the students how addiction affects mind and body, and how, most importantly, how they can play a positive role in the society. We are focusing mainly on it, so they should know how it affects and how they can play their part bringing change in society. So I would like all of you, if you have any questions, you can ask.
Assalamu alaikum, sir. I had a question. You said that the frontal lobe isn't developed.
Yes.
The frontal lobe isn't developed till the age of 25, I guess.
It's not completely developed till the age of 22, 23. It is developing, but yeah, it's not completely done till that age.
Yeah. So if a person is taking drugs and the person is addicted to drugs, so if their frontal lobe is not developed fully, so what's going to happen after that specific age?
So it will continue to develop, but you are going to slow down the development, right? So you're going to push it from 22 to 26, 27, 28. But if they keep using it, you may never reach the whole development of the cortex then, right? If they continue to use drugs. So that is why it's important, if they start earlier, they damage their brain earlier, and they are not able to achieve that control. And if you don't have control, that means your lower brain is controlling your the entire body. So you may never reach that control, because then they continue using drugs. So what we do when they come in treatment, we start enhancing the frontal lobe again. So we get them abstinent, and then with the therapeutic techniques that we have, they start doing problem solving, and they start enhancing their frontal lobe, and then the development continues from there.
Okay, thank you. That makes a lot of sense.
Sure.
First of all, thank you very much to Dr. Numan for elaborating each and everything in so much detail. There are a lot many information that are very new to us. I have only one question to sir. Sir, is this addiction, a drug addiction, is similar to a human addiction?
Yes. Yeah. So again, the main area of the brain, as I said, is the midbrain to the limbic cortex loop, and the main neurotransmitter is dopamine. So all addictions feed through that loop. So we talked about only the drug addiction, but then there are behavioral addictions like internet addiction and gambling addiction, shopping addiction. All those also go through the same path.
And so it is also connected to our neurological state of mind also. This is actually what I need to ask.
Yes. It's connected to the neurological state of mind. But if you, I'm not sure if you can elaborate, you want to know more, but yes, it is connected to how people feel.
Sir, a question आपके chat box में आया होगा, Miss Nimra Tahir का. Could you please entertain also?
Gee, let me just take a look at it. So what do you think is the role of family when someone is going through counseling or rehab process? Because at some point they're responsible for making that person the way, they may or may not be responsible for making that person the way the individual is. Sometimes, suppose if it's a peer pressure related issue, somebody goes to the school or university and they start using drugs there, and parents have no idea about it. So they may not be responsible. The role that they have is that they need to bring that person to the doctor, to the addiction specialist, and seek treatment. That is the part that they have to do. But unfortunately, as I said, because of a stigma in our society, it doesn't happen. People are like, you need to stop it. They start punishing them, taking away their privileges. And unfortunately, because the brain is hijacked, so these things don't work. I mean, you can try it, but these things don't work. So overall, like, I mean, you may have 2 or 3 cases out of 1,000. There's always exceptions, but majority research shows unless you follow the treatment protocol, the way you engage them, just confrontation and those strategies don't work with addiction. or any behavioral change. Behavioral change takes time, and you have to sort of work with it. Now, if they were raised in a different way, so that's why I was saying, if your frontal cortex was formed even when you were little in a way where it was a very strict environment, that you were told this is a poison for you, you cannot use it. Brain has such a strong connection that even if someone offers drug, they would say, no, I'm not using it. But if once someone gets addicted, it's very hard at that point. At that point, you lose that control and they need treatment. So yeah, parents' role would be to engage with the person, to tell them that this is a disease they're struggling with, and take them to the appropriate doctor so they can, or a therapist, so they can.
Thank you
Thank you
so
very
much.
much, sir.